I'm Dr. Mutscheller. I'm an OBGYN with Avenues Women's Center. I practice here at LDS Hospital in Salt Lake City, Utah. I've worked at a lot of hospitals. This is one of my favorites. I actually delivered my own baby here this year. With the COVID restrictions, we are not allowing any hospital tours at the moment. So I wanted to hopefully provide a look at how things are in the hospital for you before you come in to have your baby, and ideally answer some questions that I hear a lot about the hospital and the facility. So when you come into the hospital, you'll come into the main entrance, which is off of C Street. This is on the west side of the hospital. If you come in the east side, that would bring you in through the emergency department. Don't worry, if you go the wrong way, we'll get you to where you need to go, but the easiest way to get in is through the main entrance on the west side. Across the street from the hospital, we have our parking structure. You are welcome to park there. Coming straight through, right behind me here is valet parking. If you're in a hurry, you're always welcome to pull through this direction. If you'd like to park your car, just park in the parking structure across the street. Parking is free. On the main floor of the hospital is the outpatient pharmacy. This is really nice because if your doctor or midwife prescribes you any medications during your stay, they actually have bedside delivery during certain hours during the week and even the weekends. And otherwise, you can come down to the outpatient pharmacy in the same building on the first floor to pick up your medication. So here we are on the fourth floor where labor and delivery is located, and it's very simple if you just follow the signs to figure out where to go. Once you get off the elevators, you will simply go down this hallway where immediately on the left is the maternal fetal medicine department, and then straight through those locked double doors is labor and delivery. If you are coming in for your 20-week fetal anatomy ultrasound or for any follow-up ultrasounds, visits with the high-risk obstetricians who are the maternal fetal medicine specialists, or any of the antenatal testing, you will come here to the MFM suite and get checked in at their front desk. When you make your way up to the fourth floor, labor and delivery is a locked unit, so we have to keep our moms and babies safe. So when you come in, you'll push one of the buttons. We have one for our special care nursery and one for labor and delivery, and then they will verify your identity and let you onto the floor. Our LDS hospital here has a special care or a level 2 nursery. We take care of babies that are older than 32 weeks. So if your baby requires special care, this is where your baby would receive that. So when you come check in at labor and delivery, you'll stop at the front desk. Just make sure you have your ID card, and so we'll start there. So when you come to a labor room, this is what most of them look like. They're all very similar. We have our labor beds set up and ready for you, as well as different seating accommodations, and we always have our TV with hospital cable. So when you come in, you'll come in and get checked in and get undressed in our labor room. All of our labor rooms come with a whiteboard, which allow us to know important information about you and your family. We're able to quickly mark and identify important birth preferences, as well as know any medications or allergies, and also keep track of your labor progress in a nice format. So some of our labor suites will have labor tubs. This is one of those examples. They're jacuzzi, and we also have a hand component here if you would like to labor in these birthing tubs if you are of the appropriate risk category and that's something that you would want to do. All of our labor suites have private bathrooms, so even if there's not a labor tub, we do have private bathrooms in all of our labor rooms. In all of our labor and triage rooms, we have a fetal monitoring system. This is our standard fetal monitoring unit, but our hospital does have wireless options as well as intermittent monitoring protocols if those are appropriate. That would be something to discuss with your doctor or midwife. So some other questions I feel like I receive commonly are, do we have wireless internet? Yes, we do. We have Wi-Fi here. Do we have cable television? Yes, there's the limited number of cable channels, and we actually do have both a DVD and a VHS collection if you're here for a long time. Our cafeteria is open. The hours are not 24/7, but we do have a grill that is available opposing hours. Women frequently want to know what sort of birth options are available at the hospital, and we do offer the full range from low intervention, unmedicated spontaneous deliveries to elective inductions with early epidurals. You just need to discuss with your doctor or midwife what sort of plan you guys can come up with together, but the hospital itself does have both the policies, protocols, and amazing nursing staff that can support any of those birth preferences. Our labor and delivery has our own on-unit operating suites. We have our own operating rooms here on the same floor, and we won't venture in because you need full surgical attire, but this is where those suites are located. We have a large variety of labor and birthing equipment available, including one of my personal favorites, the peanut ball. We also have birthing bars, birthing stools, and regular birthing balls available. Our hospital does have 24/7 anesthesiologists available for epidurals and other pain control needs. You just work with your nurse to determine appropriate time frame if that was something that you were interested in pursuing. So after you have your baby on our labor unit, we'll bring you over here to our postpartum women's and newborns unit. Each of our rooms is similar. We have our hospital beds for moms and our bassinets for babies. We also have pull-out chairs which fold out into a bed. So these are for your support person if they would like to stay here with you. And then all of our postpartum rooms are also equipped with a private bathroom. So we are a baby-friendly hospital, which means we promote rooming in, but we do have a nursery available for lots of reasons, including if you need a break. Our babies also have checkups here. You're always welcome to come with them anytime they're out of your room. And we have our first bath station here in the nursery as well. So there you have it. I hope you enjoyed the tour. If you have any other questions about having your baby with us at LDS Hospital, just give us a call at 801-408-3460.